Hello, today I'm going to be providing you with some information and education on irritable bowel syndrome, otherwise known as IBS. So, what is IBS? IBS is a disorder affecting the stomach and intestines, causing a reoccurrence of abdominal pain combined with an abnormal bowel motility. This abnormal bowel motility can be classified as either diarrhea, constipation, a combination of both, or unclassified. People with IBS may have bloating, gas, or a change in their bowel habits. IBS versus irritable bowel disease. IBS is a reoccurrence of abdominal pain with abnormal bowel motility with no detectable structural abnormalities of the bowel. Irritable bowel disease is seen in patients with IBS, plus symptoms of inflammation and ulcers, causing damage to the patient's intestinal tract. IBS is considered a disorder of the gut-brain interaction. It can be seen in both adolescents and adults. However, diagnosis is most commonly made before the patient reaches 45 years of age. The disease affects up to 5% of the U.S. population and is seen in 1 in 20 adolescents or adults in the world. Direct medical cost includes both over-the-counter and prescription medications and averages from $1.5 to $10 billion annually. IBS affects men and women equally, but in the U.S., women are 2 to 3 times more likely to be diagnosed with IBS. Women with IBS make up to at least 80% of the population who suffer from severe symptoms. Pain is the number one complaint of those with IBS. There are different classifications of IBS. IBS diarrhea prominent is seen with small volumes of loose stool, usually less than 200 mLs, with the passage of large amounts of mucus. It is normally aggravated by emotional stress or eating. IBS constipation dominant can be episodic at first and then becomes resistant to laxatives, resulting in hard, narrow stool caliber and a sense of incomplete evacuation for weeks or months. It is usually interrupted by brief periods of diarrhea, most commonly from pre-existing stool burdens. When the patient is experiencing symptoms of both IBS constipation and IBS diarrhea, they are said to have IBS mixed. The fourth classification is IBS unclassified. This is listed for individuals who meet the diagnostic criteria for IBS, but whose bowel habits do not fall into the other 3 categories. Risk factors for IBS include any factor that may cause irritation, inflammation, and bloating to the bowels. Some controllable risk factors include stress, food sensitivities, hormones, smoking, alcohol consumption, diet, obesity, bowel infection, hypertension, and diabetes. Some examples of uncontrolled risk factors include age, sex, and genetics. Research has indicated that IBS is likely due to a multitude of factors affecting the bowel. However, these causes are not well understood. Due to this, most research is focused on treating the symptoms of IBS. The abdominal pain experienced with IBS is likely due to visceral hypersensitivity. This is where the sensory nerve endings in the bowel have an abnormally strong response to stimuli. This can be triggered when the bowel stretches due to gas, a stool burden, or an increase in fluid in response to an increase in solutes. Additionally, certain types of foods can cause an increase in water in the bowels, causing pain via hypersensitivity, bloating, and bowel spasms, which in turn can cause changes in bowel habits. Diagnosis of IBS is made through a thorough history and physical, with a focus on excluding other differential diagnosis, as there is no clear diagnostic test available at this time. Per the American College of Gastroenterology, a series of diagnostic tests are recommended to rule out the possible causes of the patient's symptoms. Serologic testing is used to rule out celiac disease. Fecal calprotectin and C-reactive protein are used to rule out irritable bowel disease. Routine stool testing is used for enteric pathogens. Testing for food allergies and sensitivities is not recommended unless there are reproducible symptoms concerning specific foods. IBS is a lifelong disease that can be difficult to manage. Effective treatment methods are available through medication, dietary management and changes, and therapeutic measures. Patients should seek help from specialists when they experience weight loss greater than 5% of their total body weight in 6 to 12 months, they have diarrhea at night while sleeping, rectal bleeding, unexplained vomiting, iron deficiency anemia, pain that is not relieved by passing gas or having a bowel movement. Irritable bowel syndrome does not place the patient at any type of severe health risk such as colon cancer. However, IBS may carry with it the severe risk of anxiety and depression due to decreased quality of life and the severe dietary and lifestyle limitations placed on them by the disease process. So, how can a patient with IBS help to control their symptoms? The patient diagnosed with IBS should make a point to consume plenty of fluids and introduce the addition of a dietary fiber supplement within their diet. The patient should consume caffeine in moderation and avoid trigger foods such as coffee, disaccharides, legumes, cabbage, a high carbohydrate diet, and excessive fructose and artificial sweeteners. The patient should also introduce gut-directed hypnotherapy into their daily activities. For a summary of the information I've provided to you, please click the link below and watch the video. Now that I've reviewed with you all the dietary and lifestyle restrictions that patients with IBS adhere to avoid the symptoms, let's review some ways that technology can be incorporated to improve your quality of life. The Food Map diet is designed to help you discover foods that cause IBS symptoms and avoid them. You can eat freely from the selection of non-troublesome foods on the Food Map diet. This allows you some autonomy when selecting foods, helping you to not feel so constricted by the dietary restrictions of IBS. The Food Map diet is a 3-step process. First, stop eating certain foods that are listed as high Food Map diet foods. Second, slowly reintroduce the high Food Map diet foods one at a time to determine which ones are causing the discomfort and symptoms of IBS. Finally, once the foods that cause irritation are identified, avoid or limit those foods in your diet. Understanding and logging foods on the Food Map diet can be difficult. Therefore, Monash University has created an application for smartphones that helps simplify the Food Map diet since you're always on the go. With a Food Map application, you can have easy access to foods that are recommended and avoid those that should not be eaten. The application uses 3 easy steps to help you navigate the Food Map diet. First, it helps you identify red foods that can be swapped for alternative green foods. Second, it introduces Food Map challenges to identify which red foods you can tolerate and which foods are triggers. Finally, it provides personalized Food Map diets for you to follow along and confidently enjoy foods without the worry of IBS symptoms. Another application that may be beneficial is the Nerva app. This application was designed to bring gut hypnotherapy to patients experiencing IBS symptoms due to stress and anxiety. This application offers a 6-week gut hypnotherapy program that includes meditation sessions, along with guided breathing and daily psychoeducational readings. This application can also track your daily symptoms to help determine the effectiveness of the program based on your IBS flare-ups. Each therapy session lasts approximately 15 minutes and can be accessed by your device wherever you are. This allows ease of access for your busy on-the-go lifestyle. Please feel free to click on the links below for more information concerning irritable bowel syndrome and the technology resources that we have discussed today. Please feel free to see the attached quiz to test your knowledge on irritable bowel symptoms, diagnosis, and treatment. Now is the time that I will use the teach-back method to assess the information you were able to retain from this presentation. I will also ask you for a return demonstration to access and navigate the technology we discussed today. Thank you.